So welcome everybody. Welcome back to the See Big Screen Snapshots. We're now in January 2023, and as most of you know, January is Cervical Cancer Awareness Month. So to emphasize this and to kind of support the awareness, we're doing some extra interviews for this month for the snapshots, and we're delighted to have to start this with Rachel Greenley, research fellow at the London School of Hygiene and Tropical Medicine. Thanks so much for being with us today, Rachel. I just wanted to ask you a few questions about I suppose cervical cancer and the See Big Screen project, just kind of in the context of the area that you're working in. So like the London School of Hygiene and Tropical Medicine as a partner are involved in quite a large number of the different areas of the project and work packages. Could you tell me a bit maybe about the area that you're involved in and just kind of put it into context?
Yeah, absolutely. Hi, Vanessa, and thank you so much for having me today and to be able to talk about See Big Screen because it is such an incredible program. And See Big Screen, my role is to work with vulnerable populations and to engage them in a way that maybe traditionally or typically they aren't engaged. And so See Big Screen is all about working collaboratively with stakeholders, with women who are identified as vulnerable, to best understand and implement gains by cervical cancer screening more effectively in Europe. And so with work package 3, we're really honing in on hearing the voices and hearing the opinions and directly from women identified as vulnerable or stakeholders who maybe work with women who are vulnerable or are directly within communities that these these interventions will be instituted and be used. So my role within London School, within See Big Screen more generally, is to best understand how the pathways of care are currently operating. And so that starts all the way from identification of a problem and awareness around cervical cancer to getting screened. And then if by chance a positive result is then found, then carrying that all the way through to treatment. And so in order to move forward, we need to kind of understand where we stand now and the foundation that we're building this new intervention based upon. So we've done some work to identify the pathway of care within intervention countries, as well as other countries in Europe, just to make the comparison and better understand how then when we learn about barriers and facilitators for screening and for treatment, we can mold and tailor our interventions to make screening outcomes better or to make treatment uptake better. And alongside looking at the health systems, we've also looked into the literature of what interventions are in place currently that either look at provider-focused interventions to improve screening, that looking at reducing barriers or looking at improving access, as well as what barriers and facilitators have been identified within particular areas of Europe, within particular populations. But what we've found is that there's not so much literature on many different types of factors that would then lead to vulnerabilities in women. And so as See Big Screen, we want to be able to recognize that vulnerability can transcend and intersect many different people, many different walks of life, and for different reasons. And we want to move forward then next with speaking directly to women who are identified as vulnerable or the stakeholders who engage with them. And my work package is a little unique because the way that we hear the voices of women is much more participatory than maybe kind of traditional interviews. And so by using means of digital storytelling or by kind of think aloud processes, so really more participatory ways of understanding and hearing voices, then we can better recognize really what a woman or what a nurse or a doctor working in this area experiences on the day-to-day. So that's more of my involvement with See Big Screen.
Okay, that's great. No, it's really interesting, and I think that's one of the the biggest strengths with See Big Screen, the the emphasis on actually hearing the voices of the vulnerable women to really seek them out. Is there any kind of specific issue around barriers or interventions, whether in general or in any of the intervention countries that have kind of stood out for you? Anything off the top of your head, or?
Yeah, it's been a lot of it kind of, I think, standing back, you can make sense and you can understand. But even just as simple as an organized, place holding contact information to get a hold of women, something, I come from Canada, and I don't even think I thought of that to be a problem. But very much, if you aren't aware of what services are available to you or how to be in contact to be reminded, the chances of you showing up for a screening are far lower. And just as one example, or to have information available to you in a language that you recognize, or even described in a way that makes sense to you, because everybody will understand scientific terms a little bit differently. And to be able to have that available isn't unanimous across countries. Or for instance, having time off of work to go and get screening if it's only available in certain pockets of the time. And so little maybe assumptions or little things that aren't probably considered to be a huge barrier for many is monumental for those who aren't able to maybe make those times of the screening, or to be able to follow up, and larger issues too of funding and fees. I mean, screening can be expensive, and if it's a decision to put food on your table or to go and get screened for potentially what could be a positive outcome or not, I think the decision for many is quite simple. So those are just a couple of barriers that have stuck out, but there's a lot of facilitators too. And so it's not that, the whole system is just riddled with problems, that there's a lot of really good ways that, screening is trying to be promoted as well. It's just finding the one that sticks and is important for your particular area, and context is key, and we know this. So I think that's what CBRIG Screen is doing a really good job trying to understand of what works for us at this time, and how can we make sure that we can make it accessible for all.
Okay, no, that makes a lot of sense. And like you say, there's probably a lot of positive examples as well, but obviously you tend to focus on the ones that aren't, because you want to fix them. And I suppose the positive ones can be really informative as well, but like you say, context is key. What works in maybe one country, even area specific place, mightn't work in another one. That's great. Rachel Greenley from London School of Hygiene and Tropical Medicine, thank you so much for taking your time to talk to us today. We really appreciate it. And maybe we'll talk to you later on, further on in the project, to see what more you found, but we have more maybe tangible outcomes, and we're really looking forward to hearing all about that. Thank you so much for your time.
My pleasure, Vanessa. Thank you.